Hi, everyone. Thanks for joining us today. My name is Tim Boyd. I'm the Director of State Policy for the National Organization for Rare Disorders, and I'm joined by my colleague, Rose Avellino.
Hi, everyone.
We're hosting this webinar to talk with you a bit about our plans for an Advocacy Day next Tuesday, May 14th in Boston. We're hope that everyone on this call may be able to join us in Boston next week, but even if you're not, there'll be plenty of opportunities to support what we're talking about today, even if you're not able to be there in person. So as we get started, we're just going to talk briefly, just a quick reminder of kind of who NORD is and what we do. NORD is the national, sorry, having a screen mess up. So NORD obviously is a national organization for rare disorders. We're an independent nonprofit representing rare disease patients and families, and we do this by supporting patient organizations, investing in research, providing education, and disseminating information about public policy. In addition to our policy and advocacy programs, NORD supports several different programs. We are a member-based organization and have over 280 plus disease-specific organizations that are members of NORD. In addition, we have programs of research, education, and patient assistance. And as always, even if you're ever interested in finding out more about NORD, you can reach out to any of us, and our contact information will be shared at the end of this webinar, or you can go directly to rarediseases.org. So today we're here to talk about, before we get to that, in addition to the resources that are available on rarediseases.org, NORD also has an advocacy portal, the Rare Action Network Online, where you could find information about policy actions happening directly in your state. Obviously, I assume all of you are from Massachusetts, and we have a Massachusetts-specific web portal as part of our Rare Action Network, which is located at rarema.org. You could also connect with the Massachusetts Rare Action Network on Facebook at the address you see there, and our Rare Action Network generally is on Twitter at @RareAction. I also wanted to take a brief moment to introduce two of our lead volunteers in Massachusetts who are joining us on the call today. I'll start with Alan, who is our volunteer ambassador for the state. Alan, if you want to say hi and if you have any words to say.
Just that it's nice to be here. I hope that we can get some really good advocacy going on this particular issue, and thank you all for joining us.
And I believe we're also joined by Amy as well. Amy, do you want to say hi real quick?
Hi, everyone. Yeah, sure. So hi, everyone. My name is Amy Patterson. I work closely with Alan. While Alan's the ambassador for Massachusetts, I am a community engagement liaison. So I work to, exactly what it says, engage the community and do some smaller scale events and just to involve everyone related to the rare community. And political advocacy is, I'm still relatively new to, so I'm excited to kind of jump into it with everyone else.
Thanks, Amy. And we also have another community engagement liaison on our network is Megan Worth, who's not able to join us today, but she's also a great contact and volunteer in the state. So we're here today to talk about the Massachusetts Rare Disease Advisory Council, or more specifically, the legislation that has been introduced in the state to create a Massachusetts Rare Disease Advisory Council. The bill numbers you see there on the House side, H1934, and the Senate side, SD 2264. In the House, this legislation, we're proud to see is sponsored by Representative Hannah Kane and Representative Joseph McKenna, and it also includes a robust set of over a dozen co-sponsors as well. And on the Senate, it is sponsored by Senator Joseph Feeney. We are incredibly excited about this bill, and to start out this webinar, we're going to talk a little bit about the specific mechanics of what it does, and then we're going to go into our Advocacy Day plans and how you can directly get involved. So the problem, as NORD understands it, and kind of what creates the need for this Rare Disease Advisory Council, is that there is generally a lack of awareness of rare disease. There are, as many of you know, at least 7,000 known rare diseases. It is difficult for anyone, let alone our busy state policymakers, to have an in-depth understanding of the rare disease community, the entire rare disease community, and understand kind of what are the policy levers and changes they should be considering at the state level. And that lack of awareness leads to some common difficulties for patients and their loved ones. Difficulty accessing care, difficulty finding medical specialists, just generally people understanding what rare disease means and the implication for just your general life, such as education in school, access to certain special education, access to physical and occupational therapy and the like. And just we believe that without a formal body created by the state to bring this community together and to look at potential solutions to these issues, the state will be less successful in addressing policy barriers for the rare disease community. So what the specific function of the advisory council will be, if successfully created, is to provide a formal voice for all stakeholders in the state, rare disease stakeholders, to make recommendations back to the government about ways to improve public policy for the rare disease community. And how it will, when I say stakeholders, how this council will be kind of created and who it will be made up of will be people from across the state and across various disciplines that interact with the rare disease community, such as legislators, physicians, geneticists, hospitals, including hospital administrators, pharmacists, representatives from the pharmaceutical industry, representatives from health insurers, genetic counselors, genetic specialists, rare disease rehabilitation facilities, people in the Department of Education, rare disease patients, and caregivers. The legislation itself actually spells out many of these specific roles that are mandated to be on the council. In addition, the council does have the flexibility, even if its membership does not include a certain specialty, to reach out and solicit expert testimony from anyone in the community to help it carry out its work. In terms of its specific duties, as I mentioned kind of broadly, the purpose of the council is to make recommendations back to the state, but there's some specific things it will do in carrying out that work. First and foremost, the council will be looking at using publicly available records and information to undertake a statistical and qualitative examination of the prevalence of rare diseases and developing a profile to kind of understand what is the economic burden of rare disease in the state. So right now, it is Massachusetts and nearly no other state have a strong understanding of what the burden of rare diseases looks like within their borders. And so one of the things the council will undertake is to actually try to get a better understanding of how many people have a rare disease in the state, what those different conditions look like, and what is the totality of the burden that they face that the state needs to consider. In addition, as I kind of alluded to, the council will be specifically tasked with receiving and considering reports directly from rare disease experts in the state and learning about the work that they do. So one of the main functions this council will do is work directly with rare disease organizations in Massachusetts to hear about what's going on with their communities and inform the council's recommendations. And finally, the council is going to look a lot at the economic and human impact of rare disease treatment and care, and how the various people encounter in trying to seek proper treatment and care, including trying to find an accurate diagnosis. So in addition to looking at treatment, the council, in addition to analyzing kind of the access barriers that currently exist within the state, their role, in addition to making recommendations, is to really make sure that the burden of rare disease, the struggles that people with rare diseases are encountering in the state, are well publicized and that there's awareness generally increases. And so the council will be tasked with publicizing the profile, social, and economic burden of rare diseases in the Commonwealth to ensure that the public and healthcare providers are informed of what's going on, and also to develop and maintain a rare disease plan for the Commonwealth. And what likely, in addition to that rare disease plan, will include sort of a resource hub for different existing services available to the rare disease community in the state that people may not be aware of. So before I get into how to get directly involved in Massachusetts, I just want to pause and see if anyone has any questions about the legislation itself. I know I kind of ran through that pretty quickly. The bill is relatively straightforward, but some of these specific terms and things can be a bit confusing. So does anyone have any questions about the legislation itself and what it seeks to accomplish? In terms of the specific duties of the council, as I mentioned, the focus is really on making formal recommendations to the state on ways to improve public policy for the rare disease community. And this slide kind of generally summarizes kind of what that approach looks like. But then in terms of the specific duties, it starts with the actual makeup of the council itself. So this slide summarizes the kind of different stakeholders who are required to be on the council. Again, that's legislators, rare disease physicians, and providers of all types, geneticists, hospital administrators, pharmacists, representatives from industry, including the pharmaceutical industry, as well as the health insurance industry, genetic counselors, and rare disease rehab facilities. And of course, of the utmost importance to NORD is that this representation first and foremost include patients and caregivers. The patient participation in the council is mandated, as is the participation of rare disease caregivers who do not necessarily have to be a family member. And in terms of the duties, I ran through this before, but now that you can see it on the webinar, it starts with examining public records and to develop a analysis of the prevalence and incidence of rare diseases in the state. It includes considering reports directly from rare disease experts, which includes rare disease organizations operating in the state. In addition to that analysis of prevalence, it includes determining the human impact and economic implications of treatment for rare diseases. These duties continue to include evaluating the current system of rare disease treatment and care within the state of Massachusetts, including the publicly available resources that provide treatment and care in Massachusetts, develop methods to publicize and expand awareness on the understanding of social and economic burdens faced by rare disease families and their caregivers, and then finally develop and maintain a comprehensive rare disease plan for the state. So now that you guys have had a chance to see it, and I've had to go back through it here, again, I apologize for the screen mix up. Does anyone have any questions about these duties? Great. So I'm going to move on to talk specifically about what we have planned for the 14th and how you can get directly involved. So first off, this bill, especially the House bill, has been referred to the Joint Committee on Public Health. On the Senate side, that bill is referred to the Joint Committee on Rules. Our attention on the 14th will be with both committees, but we're going to be focused most heavily on the Joint Committee on Public Health. And our goal is to convince members of that committee to support this legislation, bring it to a hearing, and pass it. And the way we'll be doing that is relying heavily on patient advocates, hopefully many of you, to join us for that day and participate in meetings directly with legislative offices to talk about this legislation. In addition, in the morning, in the morning at the Nurses Hall at the Capitol, we'll be having a short event that'll run from 10 a.m. to 11 a.m. That will include several speakers, including the sponsors who will be speaking, a few researchers that we've invited to speak, as well as a few patient advocates and representatives from NORD and Rare New England. That morning event will be focused on just creating a general understanding and education about the Rare Disease Advisory Council, and then following that event, we'll be doing the specific legislative visits, which NORD and Rare New England have taken the lead on scheduling and putting together. So if you are not able to be there in person, we are creating online opportunities for you to engage and support this legislation. You'll be able to find those once they are posted on rareaction.org or rarema.org. But if you are able to join us in person, and I hope you are, we really wanted to spend kind of the rest of this webinar, in addition to talking about some of the logistics on the day of, talk about the key messages that we hope that you will share with your representatives if you're able to join us. And for those of you who may not have done something like this before, it can be a little bit nerve-wracking and daunting, but it's a pretty straightforward process, and your ability to participate, we think, is pretty easy. And I actually wanted to see if Rose could walk us through here, kind of based on her experience in doing some of these meetings, what are some of the key messages that we hope, for those of you joining us, hope to carry with your office?
Yeah, sure. Thanks, Tim. Hi, everybody. So we, on the 14th, we'll be talking about these three main messages. So we'll divide up into groups, and we'll go around and talk to the different offices. And the first being, when you sit down in a meeting, a lot of either the staff member or the representative will ask you, what your connection is to Rare. And then in addition, we'd like to talk about, why you think, in your own words, the council is a good idea. and anything that you hope that the council will accomplish.
And we also really hope at each of these meetings that we want to give anyone joining us an opportunity to talk about their own personal connection to the rare disease community. That's really kind of the first and most important aspect for us. So if you are a patient advocate yourself, it's really important to kind of share your journey and your experience and some of the difficulties that you may have faced as a patient. If you're a caregiver or just know someone with a rare disease and you kind of know what those challenges have been, we want you to be able to share that as well. But there will be, in every meeting, there will be someone like myself or Rose to lead that meeting and kind of guide the discussion with the legislative office. All we're asking from people like you, if you're able to attend, is just speak to your own personal experience about how rare disease has affected you and why you think that the Rare Disease Council in Massachusetts is a good idea and that one that would support you.
And if you've never done this before, you've never shared your story with a representative, NORD has some tools on our website that we'll be sending out in advance of the meetings on the 14th that can help you pull out the most important parts of your story and kind of fine tune it to talk with a legislator about, why this council is a good idea and, what your connection is.
So again, to kind of recap our tentative agenda for the 14th, starting at 10 a.m. in the Nurses Hall, which is located in the Capitol, there will be a legislative briefing that is open to the public, and we hope all of you are able to attend. And following the conclusion of that briefing at 11:30, we will meet up with all of you in that Nurses Hall or right outside the hall to split up into small groups, and we'll do legislative visits from about 11:30, most likely noon, to 3 p.m. You're welcome during that time to stay for as many or as few of the visits as you are able to. And we even plan to, once we kind of get a sense of who's going to be there, to identify who your legislators are and potentially do drop-in visits so you can meet directly with your representatives. But as I mentioned before, our initial focus is going to be on the Public Health Committee. We do also want to give folks who are there a chance to meet with their own representative to talk about this legislation, because we are still hoping to get broader support within the House and Senate.
So if you haven't already, you can find out more information about the event at rarema.org. In addition, there's a link there to sign up for the event. And if you haven't done that already, I would urge you to do that. That way, if there's any last-minute changes, or we'll also be sending out this recording in addition to the toolkits that I referenced with sharing your story. That way, you're on that email list. So again, you can do that at rarema.org.
And with that, are there any other questions about the Advocacy Day or about the Council in general? All right, well, we do hope to see you there. If you have any further questions, this slide shows the contact information for members of our department. Again, I'm Tim Boyd, and Rose on my team is here as well. Feel free to reach out directly to us if you have any questions or if you need help registering. Rose and I will keep the line open for a few minutes if anyone has any questions after the fact, but otherwise, thank you and have a great day.